Sherelle. Okay, thank you. Good afternoon, everybody, and welcome to the Health and Human Services Committee of the Wayne County Commission. Madam Clerk, I know that Chair Baker McCormick, has an excused absence for this meeting. Would you please take the roll, Madam Clerk?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Daub.
Here.
Commissioner Anderson.
Present.
Commissioner Killeen.
Present.
Commissioner Baker McCormick.
She has an excused absence.
You have a quorum present.
Thank you, Madam Clerk. Item B on the agenda, the approval of the December 14th committee minutes. What's your pleasure?
Move approval, Anderson. Support, Marecki.
Thank you very much. Is there any discussion, additions, corrections to the minutes? Hearing none, we have a proper motion before us. All in favor of that motion, please say aye.
Aye. Aye.
Aye. Anybody opposed? All right, Madam Clerk, what's next?
C, old business. There is none.
All right. As we go into new business, Madam Clerk, I would like to move item 3 up to the beginning of the meeting to have our discussion with Dr. Hamami.
Item 3, we have an update from Dr. Mohamed Hamami regarding COVID-19.
Thank you. So Dr. Hamami, thank you once again for visiting us today. The discussion is going to revolve around mostly the vaccine, how it's being rolled out, its availability to Wayne County residents. The story on the vaccine is changing on a somewhat regular basis, so I want to get the current and best information out to people about what expectations they can have for going forward in Wayne County and how to access vaccinations. So Dr. Hamami, if you are ready, I think you have to share a screen if I'm not mistaken.
That is correct. Thank you, Mr. Chair. Mohamed Hamami, Chief Health Strategist for Wayne County. Always good to come and update the committee on the progress that we are having during this pandemic. Do you see my PowerPoint?
Yes.
Great. I only had a total of 6 slides, and I thought I would give a little bit of an update in general of what is the distribution process, what it means when we say vaccines are available, how they are coming down the pipeline to the state and to eventually the county and the health department. Then talk a little bit about the numbers of how many doses have been shipped, how many doses have been administered. I will also talk about what does it mean as we hear about the different phases. Which phase are we in? Is it 1? Is it B? What each phase is? And then I will pause there, and I'm sure there will be a lot of questions. So let me start by talking about the distribution process. So at some point in November, all states were required to submit to the CDC their plans of vaccination. And based on these plans, this is how the CDC started planning how they want to allocate the vaccines when they became available. We know that 2 vaccines became available towards the end of the year in December through an emergency authorization use. The CDC allocates doses to the states. Those doses are shipped from the manufacturer to the state. The state then distribute those to local health systems as well as local health departments across the states. As soon as one shipment is shipped by the CDC, a exact amount is reserved for a second dose. So if you receive 900, you have 900 reserved and so forth. Another allocation is done directly from the CDC, bypassing the states to retail pharmacies. Retail pharmacies had to enroll with the CDC with the specific task to vaccinate those that are in long-term care facilities. And the two major retail pharmacies that were federally enrolled are CVS and Walgreens. So anything that we're going to talk about does not include those that are directly enrolled with the vaccine program. So with that said, I thought that it would be useful to talk about the supplies that we all hear about. To put it in perspective, the United States, all total, the USA, 25.5, so almost 25.5 million doses have been distributed, of which only 9 million has been administered, and that is nationwide. As it relates to what we are dealing here in Michigan, we mentioned there are two vaccines. There is the Pfizer, that is the notorious one that requires the low temperature storage, the cold chain, logistically is harder to manage, but it was also the first to be approved for emergency use authorization. And then the Moderna, which is a little bit easier to handle, and this dictated who gets what and how many doses are available from each vaccine. But as you can see, in total, the state of Michigan has distributed close to 850,000 doses, of which Wayne County got 24,000. The majority that Wayne County got was 20,475. And when I say Wayne County, everything is excluding the city of Detroit. The city of Detroit, as everybody knows, has its own health jurisdiction, and we're not including their numbers in. So total Pfizer shipment shipped to Wayne County was close to 20,000, of which 12,000 and a half almost went to hospitals, and none of the Pfizer vaccine went to federally qualified health centers. These are the community health centers because of the nature of how you need to store it. Another 3,600 doses of the Moderna went to Wayne County. Again, the majority went to hospitals, 3,400, and federally qualified health centers received only 200. So in total, Wayne County received about 24,000 doses of both vaccines. 16,000 went to hospitals, and 200 went to federally qualified health centers. Now, the administration record is different, and the state of Michigan has administered between the two vaccines close to 233,000 doses. If we look at how many shipped, that is a very small fraction. But if we look at Wayne County, of vaccine shipped 24,000, almost 22,000 have been administered. So Wayne County isn't lagging like the rest of the state. And if you look, there is a heat map on michigan.gov website that has color-coded, and you can see that mostly those that are lagging in administration are those that smaller counties. So I assume some capacity, but also outreach. These are more in the rural areas. Hospitals in Wayne County, again, administered the bulk of the vaccine between the Moderna and the Pfizer, close to 17,000 doses. And the FQHCs, remember, they only got 200 of the Moderna, and already they have administered 135 of the Moderna vaccine. Again, these numbers do not include the city of Detroit. As it relates to us as Wayne County Public Health Department, as I mentioned probably previously, we had the capacity to keep the vaccine and maintain the cold chain, so we were assigned the Pfizer vaccine. Every time we order a shipment, we order the maximum allowed. These are funny numbers because it comes in increments of 975, which are called trays. So when we order the maximum amount, we order about, I believe, 4 trays, and that totals to 4,875. But what we get is less than what we order. And unfortunately, we do not know how much we're getting until, so we order on Thursday. By early Monday or Tuesday of next week, we get a confirmation of how much doses have been approved. Then a day after, we get a note that says your shipment has been shipped and you should expect it on such and such date. So that makes it a little bit challenging to plan how many doses you are going to get because to give, because you don't know how many. So the first shipment we had almost 3 weeks ago, or now 4 weeks ago, was in December 17, and we got 1,950 doses. We have exhausted that shipment completely. We have administered all first doses in that shipment. We received a second shipment, which as you can see, it's half of the initial shipment of 975, but we received only one tray, and we also exhausted that. As of yesterday, we were down to 33 doses left. We were very happy to receive yesterday at 11 a.m. another shipment, and this time it is more than what we were getting allocated, and that is 2,925. So these are 3 trays. We've already, as of yesterday, used 450, and we continue, as many of you know, we are doing drive-through vaccination every day, including Saturdays. So this shipment is probably going to be exhausted by the rate that we're going by probably mid of next week, and we hope that this is where the second shipment comes in. So in total, we received 7,800. I'm sorry, that number includes second doses. We also have administered. Friday was the second dose. As you know, second dose is 3 weeks after. So those that we started on the 17th, Friday was the time for them to get their second dose. We had some on Friday, some on Saturday, and the majority are coming today and tomorrow. And we have administered 141. These totals include a 1950 shipment of a second dose. So these numbers are not as accurate. The remaining doses for the first dose is 2,475, so 2,475. I apologize for this. Let me move to when we talk about the phases. And many of us know that there has been a prioritization schedule that was updated by the state. The last time it was updated and published by the Michigan Department of Health and Human Services was on December 29th. And it moved us from initially, it was 3 stages, now into 2 phases. There is phase 1 and phase 2. Within phase 1, there are 3 groups or 3 phases, phase 1A, phase 1B, and phase 1C. Within each phase of these, there are priority groups. So priority groups in phase 1A include priority group 1, which are the critical healthcare. These are everybody, and I'm going to go into more details to phase 1. But critical healthcare, these are the frontline medical workers. Priority group 2 are the long-term care staff and residents. And priority group 3 are what is called necessary healthcare. This includes everybody in healthcare that does not work in a hospital or an emergency room or in a ward that is caring for COVID-19 patients. So this includes dentists, pharmacists, urgent care, ambulatory care, dialysis, laparoscopy, endoscopy, everybody in that. Phase 1B includes the critical infrastructure and frontline workers. That has 16 categories or subcategories in it. This is where law enforcement, teachers, restaurant workers, agriculture workers, and so forth, including what they call government entities, such as Wayne County employees, municipality employees, and all that. These come in the 10th subcategory in this prioritization. It also includes people that are 75 and older. Phase 1C includes those are 65 and older, and anyone under that age that have serious medical conditions that put them at a higher risk. Phase 2 includes everybody else, and this is what people refer to as the public. And this is when anybody that asks you, they say, I don't fit in any of those categories. I'm just a normal person, 40 years old. I don't have any medical conditions. I am not an essential worker. Where do I get and when do I get my vaccine? This is where this phase kicks in, and it doesn't seem that we are going to get to that anytime soon. On January 6th, the governor moved the state of Michigan to phase 1B, although we haven't completely cleared phase 1A, but she moved us to phase 1B, and she picked 4 priority groups in that critical infrastructure that included public safety. These are the law enforcement, the education, and this relates to school teachers as well as daycare staff, and then correctional staff, and these are mostly the sheriff deputies and anyone that works in a correctional facility. She also picked the group of 65 and older from phase 1C and included them in this phase. So we are technically, and this was announced that starting January 11th, we are technically now moving almost 2 phases and a half at the same time. We are still addressing phase 1A. We are now moving 4 groups from phase 1B and starting to use those or address those. And we have picked half of group 1C to move all at the same time and with an initial date of January 11th. As you all can expect, and I'm sure many of you have received many calls from everyone that this is included in, saying it is Monday, January 11, how can I come and get my vaccine? And I wish that there was an easy answer to address that. So let me break down a little bit more details into phase 1A. And just to give you the estimate population and the magnitude of what we're talking about, and specifically why we are still in phase 1A, although the state has moved. Now, smaller counties or smaller areas might have been able to move to 1B, but this would tell you why we cannot move to 1B with the same speed that everybody else is expecting us to. So the categories highlighted in yellow are what we were told by the state is the responsibility of the Wayne County Public Health Department. In Group A, we have the emergency medical responders. These are EMS, as well as the fire departments that are the first responders in terms of ambulance. And that estimated population is 1,600. In priority group 2, these are the skilled nursing facilities, the adult foster care, the long-term care, staff and residents that were not enrolled with retail pharmacies. We discovered several that were not enrolled in out of Wayne County with the estimated number of almost 2,600. Priority group 3, which was most challenging, and we learned that this is ours to be responsible for on December 29th, were everybody else that does not work in a hospital. So these are the dentists, urgent care, as I mentioned. And it is such a hard to reach population, and we estimate that they are between 25,000 and 50,000. We reached out to professional associations, we reached out to medical societies, and then we set a link on the county website for practices to register. And we asked them, how many do you have in your staff and how many are interested in getting the vaccine to estimate that volume. The link went live last week on Thursday, and as of today, we have received registration from close to 1,200 practices with a total number of staff of close to 15,000 and 11,000 that all said they want the vaccine. So again, this explains why we are still in priority group 3 and cannot move to priority group 1B yet. This would give you a snapshot of where we are. We have completed the priority group 1 in phase 1A for dose 1. We just started dose 2. We have completed all the long-term care facilities and skilled nursing facilities that were not enrolled with the retail pharmacy for dose 1. We are also this week and next week doing dose 2. And we are now doing the first dose for those medical providers the 11,000 and growing that are in priority group 3. We have reached out to those 3 categories in the frontline essential workers, the law enforcement, education, and correctional staff, and we're working on getting the exact number. We're working with RISA, Homeland Security, and the sheriff to get us the total numbers of those that need the vaccine or willing to take the vaccine. And we expect to start doing this by mid of next week, but it is safe to say that probably by January 25th. Now, a big disclosure here, or the big disclaimer, is all this depends on how many vaccine do we have and the frequency of shipments we get. When we came to the 2 groups that the governor have included, and these are the 65 and older, and this is where everyone is calling anyone that they know to ask, when can I am a senior 65 and older, when can I get mine? It was virtually, it was a big challenge. I wouldn't say impossible. It was a big challenge for us to know where those people are, as well as to give them appointments to say Mr. Smith is going to come at 10 and Mr. Brown is going to come at 10:15 and keep that. And especially the way we are set up, it was virtually impossible to be able to do that. As I mentioned probably previously, we have a coalition that meets weekly that the county has established with our health systems in out of Wayne County, specifically Beaumont Health, Henry Ford, St. John, St. Mary, and Garden City. And we reached out to them, and they, in the spirit of collaboration, and I have to praise all the efforts and the spirit of collaboration that we had, they said, these are our patients. We have at least a good slice of the 65 and older population. So anyone that belongs to us as a health system, so you are a patient of Beaumont or Henry Ford or Garden City or whatever, we will take that and we will vaccinate those seniors, and we will make sure that we send them notifications and tell them you can get your vaccines from us. That left those that do not belong to any healthcare system. Beaumont Health was the first to step up to the plate, and they said, we will also take those. All they have to do is go on the website and register through My Chart, and once they become part of the system, they can request an appointment and they can get their doses from us. I spoke this morning with Henry Ford, and they are considering the same, and I know that other health systems are going to follow suit. Tomorrow we have another of our regular scheduled calls with our partners in the health systems, and we believe everyone will do that. This is going to take a huge burden off the health department hand in handling this very fluid population, as well as this very medically demanding population. So what we need to and what we started putting out there has been a press release and any news outlet or media we can use to ask for all our senior residents that are 65 and older not to call the health department, because the message is going to be you need to get it from your health system. Rather, there has been information that has been put on the website, at the county website, as well as these health system websites, as to how you can get your vaccine through that. That leaves us with the remnants of the phases, and this is something that we will, at now we are not addressing. All those other subcategories in Group 1B and the remnants of 1C are things that we are going to wait to see how we are moving this population and what the state is going to change in terms of their directive and where do they get us to. I'm going to stop now and stop sharing my screen, because I'm sure that there are many questions. So let me see, how do I stop sharing my screen?
Got it. We see you there, Doc.
All right.
Thank you so much for that presentation, and that's a lot. And I am going to, as we usually do in this committee, go around for questions. I see we also have Commissioner Varga and Commissioner Scott with us. So when the committee's done asking questions, I will call on them. I'm just going to ask a couple to kick it off here, Dr. Hamami.
Yes, sir.
Just for clarification, Are the hospitals getting shorted on their orders just like we are as a county?
As far as we know, everybody, including even the state, are not getting what they asked from whatever source they get it. So the state didn't get what they expected from the federal government.
Yep.
We didn't get what we expected from the state, and so forth. You can only distribute what you have.
That's correct. So this is across the supply chain.
Correct.
People are not getting what they're asking for. And the other one I want to ask for, you use the terminology, we are vaccinating daily as a county.
Yes.
But as we just saw with the numbers, we don't have that many vaccines. A question that comes in quite often to myself, and I believe other commissioners, is they'll see, oh, but I see Macomb County, the county itself is making big deal. You know, we're vaccinating people, or Oakland County is. Is what's really happening there, just like in Wayne County, where the county is kind of partnering with the health systems, and the actual vaccines that are going in people's arms are the ones from the hospital systems when they say, oh, there's a Oakland County or a Macomb County? Is that really what's happening? It's the hospital systems vaccinations that are being used?
I believe so. Whenever you see large numbers, so again,
Yeah.
what I showed when it says vaccines administered in Wayne County are 23,000. We know that this is not only the health department. This is everybody that had vaccine and administered.
Right.
The numbers that are more realistic, if I wanted to say we as a county health department have administered 3,500 doses, then that makes sense, because I doubt that
Right.
anybody as a local health department received anything beyond a couple of thousand doses.
Right. So we did 3,500, but the hospital systems have done about 20,000 so far.
Yes, yes.
Okay. All right. So I'm going to open the floor to questions from commissioners on this. Commissioner Marecki, if you're ready, I will start with you, ma'am.
Thank you. I am ready.
Thank
Thank you,
you.
Mr. Chair. Thank you, Doctor, for this presentation. Extremely helpful, especially the part about the hospitals agreeing to take all the people over 65 years old. I'm wondering, I'm getting some emails now. I'm wondering if you could go through the hospitals that you mentioned. I only thought it was U of M and Beaumont at one time. Would you mind repeating so I can let people know if they're tied into those hospitals, they will either be contacted by their portal or some kind of letter to their homes? Because this is going to clear up a lot of concern with the seniors, because that's who I'm getting the letters from, are the seniors.
I can expect that, Commissioner. Yes, yes, absolutely. So I'm specifically talking to those hospitals that are within Wayne County and out Wayne County. I am sure they are using the same across the Tri-County area and as well as the city of Detroit. But those that we know and committed for sure to vaccinate their own 65 and older population are Beaumont Health, Henry Ford Hospital, Garden City, St. John, and St. Mary, with a caveat. St. Mary did not receive the Pfizer, they received the Moderna, and I know that they are challenged with the availability of vaccines. So there might be a lag over there.
Okay.
Those,
and,
yes.
Oh, go ahead. And I know they have some satellites in Wayne County, but are they?
We do not have, I assume they're going to do the same, but we didn't communicate with them, and they are not part of that coalition. But probably if they are, then they should have something on their website. Those that are, again, the public that are, or the seniors 65 and older that are not patients of any of those health systems, currently, as of today, only Beaumont Health have indicated that they are willing to take their non-affiliated patients, but they have to go again on their website and register through the MyChart portal. This is a patient portal, and this is how they become able to do that. Henry Ford indicated they want to do this, but they are still ironing some of the capacity that they have and be able to do so.
Okay, well, this is extremely helpful. I want to make a note about the chair had mentioned Macomb County, they're getting all these kudos, but I heard the CEO today and yesterday say that they are not getting the vaccines. They're ready to vaccinate 19,000 people a day, but they're not getting them. So he's kind of set that straight, because I think the newspapers were making it sound like only Wayne County wasn't able to do all this. So just so the commissioners know that, he's been on 2 days in a row saying they're in the same boat that everybody else is in. And just one other question. You mentioned phase 3 or priority group 3.
Mhm.
There's 11,000 or 15,000 in that group.
So we estimate that there must be at least 50,000 total in that group.
Oh,
But
50. Okay.
Yeah, but who registered? Because we established a registry.
Okay.
Those that already registered, every day we get at least 500 that are registering through our portal. The total in the past 5 days, we have almost 15,000 total that said total staff in these practices, but of which, because we wanted to gauge the how many are willing to take the vaccine, so we know how to that. So of that 15,000, close to 11,000 that said we want the vaccine. So as it translates to us as a health department, since we are vaccinating those, then we need enough for 11,000 as of today. Tomorrow, the number is going to get more and more. And that's what we are doing day by day.
Okay. All right. Thank you. I think that's it. These are just some things I want to put into an updated letter. And these are people that are contacting me are like 75 and older, so they need to get a hold of their healthcare providers in this area, and I'm sure that'll be quicker for them. Thank you so much for this presentation. Totally appreciate it. And I think that's all I have right now, Mr. Chair. Thank you.
Yeah, and thank you, Commissioner. And Commissioner, I will come back for a second go around as other questions occur to commissioners while other discussions are going on.
Okay.
Dr. Hamami, can you share that PowerPoint with the commission, please? So that we can get those figures to all commissioners.
Absolutely, sir. Yes.
Yeah, email it to me, clerk of the committee, wherever you usually email those things. So that would be great. Thank you.
Sure.
And I also want to mention here, and we'll mention later on, waynecounty.com/COVID-19. I don't think we have the ability to put that up on the screen, but waynecounty.com/COVID-19 has everything that we're talking about here. It also has the daily, because the stuff is changing daily, almost with the vaccine. There will be the daily press releases from the county, keeping people updated at that site. Also at waynecounty.com/COVID-19 has the links to the state of Michigan. So you can go right from our website to the state of Michigan, look at everything that they're saying there. And so all you need is waynecounty.com/COVID-19. So you can stay up with the county information as well as the state information. And I'll mention that again later. All right. Continuing now with questions from commissioners. Commissioner Dobb, do you have questions, please?
I do, Mr. Chair. Thank you. Dr. Hamami, can you give us maybe some words of reassurance or some words of encouraging some patience amongst people? I know that everyone is really, ready to get the vaccine. I'm kind of getting the impression from people who have reached out to me that there's that feeling of impatience, maybe a fear that there won't be enough of the vaccine. Everyone else is getting it, but I'm not getting it. Well, how can I get my vaccine now? Are the pharmaceutical companies going to continue to manufacture these vaccines until all of the phases have been completed? Will there be enough for everyone?
That's a great question, Commissioner, and thank you. And I think you said the magic word, which is patience. And this is what everybody, including us, should acquire, that patience. So, as you know, there are several vaccines that, beside the Moderna and Pfizer, there are several vaccines that are also being considered by the FDA. There is 3 specifically in phase 3 these are the AstraZeneca, which is already in use in Europe. There is the Janssen, and then there is Novavax, which is also a European vaccine that is being considered for use in the United States. Worldwide, there are others. There is a Chinese vaccine, there's a Russian vaccine, there's an Indian vaccine, and all that. As it relates to us here in the US, the 2 manufacturers, Pfizer and Moderna, are making more supplies. The federal government has already purchased, for the first wave, has purchased 100 million doses of the Moderna and 100 million doses of the Pfizer vaccine. My understanding is that they also placed 300 million doses order of the AstraZeneca. So the minute this becomes approved, then we'll have an extra 300 and then 100 million of the Janssen and 100 million of the Novavax. So hopefully, if these are approved through, an emergency authorization use, then we are talking about close to, if my math is correct, close to 800 million doses. And let's split them in half because these are 2 doses. Then this is 400 million doses, which are enough and should be sufficient for all our population, not to count that there are more that are being made and we can also purchase more. But the key is when and how and the timeline, how these are produced. And this is where we ask people to be patient. And the whole reason why there is a prioritization phase and all those phases that we went through is because of the scarcity of the vaccine right now. That doesn't mean we will run out, but that means some people are at more risk because of whatever, whether their occupation or whether their health conditions or whether their age. And these are the first we need to tackle and then move to those that are at lower risk. With that, there is also the need to re-emphasize the message that because of those stages and because not all are being vaccinated, then we are not yet out of the woods. We still need to observe face covering and physical distancing and restrictions and so forth going down the road until we reach that magic threshold that people say it's between 70% to 85% of all people getting vaccinated. But that timeline is not anytime soon. So many people think that, okay, I got vaccinated, let's go have a party and let's go do all what we were doing back in February of last year. That is not true.
Okay, thank you. And that was actually one of my other questions. Is it recommended to continue wearing a mask and practice social distancing, et cetera, after you've received that vaccine?
Absolutely, absolutely, because you're not only protecting yourself, you're also protecting others. You might be immune now because you have the vaccine, but that doesn't mean that you might not be carrying the virus and giving it to someone who is not vaccinated. And this is the whole concept of herd immunity.
Great. One final question. How is the state distributing to local and county health departments? Is it based on population? Are we as Wayne County having the most people in the state? Are we getting more vaccines than maybe a rural county up north that doesn't have as many people?
I mean, logically, you would hope that this is the case. I don't know if, I'm sure this is a consideration, but I don't know if that is the case. I think some factors related to capacity and also the state is able to see how many doses are being administered because we enter everything at the end of the day in the MICR registry. So I assume, and I'm just speaking on my behalf, not from the state's behalf, but if I am looking at that and I see someone who is low to 10 doses and another that still have maybe 100, then maybe I'll prioritize the one that is lower than those that are not.
Okay. All right, that is all I had. Thank you. Thank you, Dr. Mohami, and thank you, Mr. Chair.
Sure.
Thank you, Commissioner Dobb, and we will get a second crack at this as questions occur to people, so I'll come around one more time. Commissioner Anderson, do you have questions for Dr. Hamami?
Yes, I just wanted to, I've got a short list, but Doctor, one of the things I did want to ask, and I think one of the answers has already been given about the slideshow or the presentation, but I did wonder, are there any plans currently for getting vaccinations out to some of our senior facilities that are may have 100 to 300 seniors and that have no transportation, that have fear of going to a hospital. They're concerned that they might get it, but there's a lot of them. The biggest problem is getting them there. And
Right.
if
Right.
we have something like that, because I know at least 3 or probably about 6 within my district, the 3 communities that I'm getting those calls.
That is a great question. Thank you, sir, for asking that. And in fact, yesterday our internal team, we were discussing this specific population. Of course, if they belong to a long-term care or skilled nursing or even an adult foster care, then these are already a priority group 1A, and we have covered those. But those that are either homebound or those that are in as you said, they do not go out, then right now they're probably going to be in the population of 65 and older, but not at the top for 2 reasons. Again, the availability of vaccine, and since we have entrusted that whole population with the health systems. And the second, because these are more homebound and they're not as mobile as the others, then their risks of exposure might be less. So we want to get to those first at risk, and then based on the supply and the capacity, we want to devise how we can do. Maybe someone goes to these senior centers or someone goes to those that are homebound and reach out to them. We don't have anything solid as of now for these reasons that I mentioned, but also how many are there and how do we reach out to them and how much do we need in terms of vaccine supply.
I appreciate that, and I understand that it doesn't allay the fears that I think some of the seniors have, that they're going to be left out and not get that. So I think it's really important that we communicate with them very.
Absolutely. Now, one thing that I would still say that although many of this population is homebound, but I assume at some point they also see a doctor. So this is where reaching out to their healthcare provider, and if that healthcare provider is part of any of the health systems we mentioned, maybe that is how they can get it.
Okay. And another thing that is with the senior population too, that we have the hospitals and the networks of the medical providers that want you to sign onto a portal, and a lot of seniors don't have access to a computer. They're unable to sign on to the portal. Are there any provisions being made that they can call in and reserve? I know Meyer has announced, and I found out from someone else that they were actually they would send someone a text. Well, that might be an issue too for some seniors, but it at least I think takes care of the ones that don't have that don't have computers or are not able to take advantage of a portal or signing up online. But are there any provisions being made to reach out to those folks and allow them to sign up?
Yeah, the short answer is yes. And all those are points that we also discussed and considered. Down the road, and again, we are talking, we just started this whole process 3 weeks ago. So we're learning, we're building the ship as we are sailing in it. So right now, what we're hoping is that any help from family members, a senior who has children or grandchildren that can help them in accomplishing this, then we certainly would appreciate that. Our health system partners are looking for other ways that they can also, whether it's a text or hotline or a call-in system. But again, these are being put in place stepwise so they do not overburden. The minute Beaumont Health announced that they are accepting, their website crashed. And you can imagine. So we're trying also not to overflood the systems as well.
Right. Do you know when any of these medical providers, the hospital associations or Beaumont or Garden City, are going to be receiving their their vaccines where they can start doing this? Actually,
Yeah,
in the Army?
I don't have exact information, but I know that they, just like us, are expecting at least a set frequency of a weekly shipment. How much is, again, we don't know. I think they started, I know that Beaumont specifically and Henry Ford has started emailing their own patients with a timeline and with dates and what it takes for them to request and schedule. So that process has started. Um, uh, Beaumont specifically has centralized this whole process. They have their center in Southfield, and they have the capacity of moving close to like 11,000 patients, again, if they have the vaccine. So the experience they had in vaccinating their own medical staff, and because of their capacity, has enabled them to put a robust system and a streamlined system in place. And this is why it made perfect sense for them to take that population and for us to trust that they are going to handle it in the best way.
Thank you. The other question I have is as far as the when someone is in the system or you get vaccines, you said they automatically assume one is for the initial vaccination and the second is the follow-up. So there's some controversy right now as to whether or not the incoming president said he wants to release all the vaccines. And is that going to affect that? Because I'm sure that's causing some concern out there that whether or not that's going to be the case. But it sounds like you said that when they ship to us, whether it's Wayne County or whether it's another medical provider, they're actually sending 2 doses for each person. I don't know how they're maintaining those to make sure that when Susie or James comes in and gets that shot, if that's going to, I realize it wouldn't be possible that it's going to have their name on it, but I would assume there's some a computerized system that says these are in reserve for other
Yeah,
patients.
so Commissioner, let me clarify. I think what I said wasn't clear. So when we are not getting shipped 2 doses per person. So what I said is that let's say today I received 1,000 doses. Then immediately Wayne County Local Health Department has on reserve at the CDC 1,000 doses for a second shipment. That won't be released until we go and order it. So our ordering system, we have to specify, are you ordering a first dose or a second dose? The second dose should always match whatever you received for the first shipment. So the fear of someone getting a first dose will not have a second dose is almost non-existent, or at least very, very, very minimal. As for your first question about the new administration and their plans, I think this is yet to be seen. And if it's decided that we're going to release everything, including first and second dose, then it becomes our responsibility in making sure we track those and we keep monitoring our supplies. Currently, the state has advised us to not save anything for a second dose because that dose is reserved, and when it's time and ready to receive it, you can order it. And we have had that happen. So we did receive an initial shipment on December 17 of 1950. When we went online and ordered a second dose, we got the second dose for 1950 exactly, and this is what we're using for the second dose currently.
Okay. And Mr. Chair, I'll be done in just a moment. I wanted to ask also.
You have the floor, Commissioner. Take your
right,
time.
The efficacy of the vaccine, how long that's good for, because I've heard some reports that it may not, it's probably not going to be longer than a year, but I thought you might have also picked something up that might be beneficial.
Right. I think it's too early. There has been some reports. I believe Pfizer did announce either yesterday or today that they are certain that it's good for 1 year. There has been earlier reports that said it might be up to 3 years. I think we don't know until that time lapses, but even 1 year I think is absolutely wonderful, because that's what we get for the seasonal flu. And it seems that if this is the case, then the COVID vaccine would become similar to when we get the flu shot, you get also a COVID shot.
And I think makes it even more important for us to try to get everyone vaccinated, as many as possible within that first year.
Absolutely.
And then
Absolutely.
reduce the likelihood that we're going to see a large outbreak in the future.
Sure.
But that's all I have right now, but I appreciate the answers and appreciate you doing this today.
Pleasure.
Thank you, Mr. Chair.
Well, did I do the right thing there? I didn't cut myself off, did I?
Your picture is gone.
Oh, there we go.
There you are.
Thank you, Commissioner. And Commissioner Varga and Commissioner Scott, I'm going to come to you in just a second here. A couple of things have come up on the chat that I would like to address before we move on. And I'm going to address the first one myself, and then Dr. Hamami, if you want to jump in and tell me how wrong I am. Cheryl Olson, who's attending the meeting today, sent through the chat that, we have that Midwest Consortium of Government, and that I imagine this is the National Health and Human Services has agreed to release, she phrases it, millions, I don't know what that means, of the vaccines to those 8 states that are currently being held back by the Trump administration. And then she comments that we need to press for a higher number of vaccines to come here to Wayne County. Let me address that question this way. There simply is not enough vaccine out there to do everybody right now. And you better believe that every jurisdiction is pressing for more vaccine to come to their jurisdiction. And I'm sure we are, and I'm sure the city of Detroit is, as well as the hospital systems. But I will comment that the last thing you want is the number of vaccines that your local jurisdiction receives is in direct relation to the political power of individuals in that jurisdiction. We need to distribute this vaccine without regard for the politics involved, that we follow the CDC guidelines and do it in an even-handed manner. If you have some politically powerful folks that might drag vaccines away from other jurisdictions that are not as politically powerful, and then short the people there. So in my opinion, yes, everybody is pressing for more, and there simply is not enough vaccines for everybody right now. But the more we can distribute them and do it by the CDC guidelines and have it even-handed from the public health is, in my opinion, the best way to go about it, not who the powerful political folks are that can drag additional resources to their area while other people are being left short. So I hope that answers that question. And I don't think he's on the call, but Commissioner Knisik is asking about school teachers and their vaccine. Dr. Hamami, do we know about that? And I see Senator Polanki is also on the call here, and she is also concerned about teachers. So
absolutely. Yes, sir. I can answer that. So as I mentioned earlier, education has been one of the group prioritized by the state and the governor mentioned. And we certainly are considering those in the same level as law enforcement. The way we are handling this, since early in the pandemic, we have been working very successfully and efficiently with RISA, which is dealing with the school districts. In order for us to know how and when to start scheduling teachers, we need to know, again, how many teachers and which school district they belong to, so we can put them in blocks. So rather than to reach to every school in Wayne County, we approached RISA, and again, we've been working in a great way as partners through this. And RISA volunteered to get all this information. RISA reached to all the school districts, asked every school superintendent to survey their teachers, how many are there, and we're not only talking about teachers, we're talking about everybody who is in a school building, because we want to offer that protection so we can resume in-person classes. This survey is expected to be given to us by the 14th, so hopefully tomorrow or the day after. Once this survey becomes in our hands, then it becomes a matter of scheduling. Again, scheduling is going to depend on how much vaccine we have. So can we do a 2 school districts every day, 3 school districts every day? It all depends on, are there 50 or 25 in each school district? And that's what we're dealing with. So this is why everything is coordinated with RISA. And I see that a question about charter schools and private schools, although they are not covered by RISA, but RISA is also reaching out to them to get us that information as well.
All righty, thank you. And Doctor, does that include charter schools?
Yes, sir. Charter schools, private schools, all those are going to be included in RISA's survey.
So this is all part of continuing to build the ship as we're leaving port.
Yep.
And so that's the situation. I also want to clarify the comment, because it's come back, that the governor's press release today said millions and was not specific on that. Okay, let me go. Commissioner Varga, do you have a few questions here?
Actually, all of my questions were already asked, but I could just say that I do know firsthand that Henry Ford has started their process and did send out emails to most 65 and over. And they did ask for everyone to sign up for portals, and that is what they're going to use to schedule their appointments. So I can verify that one. Thank you.
Commissioner. Thank you. Commissioner Scott, do you have any
Sorry
questions?
if I find a.
I'm sorry, Commissioner.
No, I sound a little hoarse today. Sorry about that.
That's okay. Don't party so late at night, Commissioner. Commissioner Scott, do you have a question or 2 or 3 for Dr. Hamami? Is Commissioner Scott still with us? Okay, Commissioner Scott, let me know when. Oh, you're there.
I was muted. I'm sorry.
No problem, Commissioner. You have the floor.
Okay, thank you so much. Okay, I think Commissioner Anderson has asked several of my questions, but I want to know about the qualified health centers. You know, I have one in Hamtramck and there's one in Western Wayne. Now, will they be getting the vaccine?
Yes, Commissioner. So you know that we are, the one in Hamtramck is actually part of the health department. So they did receive an initial dose of the Moderna vaccine. However, they literally received a very small shipment. I think it didn't go beyond 40 doses. Initially, the plan for the federally qualified health centers is for those that have the capacity to vaccinate other staff in health centers in priority group 1A. We are working to see if we can get them Pfizer vaccine as well, because we do have a freezer at the clinic in Hamtramck and we can store it. And if we get at least 1 tray, which is 975 doses, then that immediately increase our capacity to vaccinate more people. So we're working with the state to see how we can boost that. But yes, FQHCs did receive an allocation of the Moderna doses.
Okay, they just got the Moderna, but you're going to see if they can get the Pfizer also?
Yes,
Is that
ma'am.
what you said? Okay.
Yes.
Now, I have a lot of seniors. in Hamtramck, I just have one senior building, but there are a lot of seniors. And I just want to know how I can help all of them. How do you suggest I do?
Again, what we mentioned, whatever health system they are affiliated with, then that would be the first priority. I know they're closer to Henry Ford. They might be affiliated with Henry Ford. They might be affiliated with DMC. It is something I didn't include DMC in my report because it's more considered the city of Detroit, but probably most of them are part of the DMC patient population and they can get it from DMC. So that would be the first option. Those that are not affiliated, again, we mentioned Beaumont is willing to take those as well as eventually others. And lastly, if there are other clinics that, let's say the health center, the federally qualified health center has more doses and we decide that seniors can get those from the health center, then that would be a third option, but it is not happening yet. So I don't want to have them go to the health clinic and just discover that they do not have doses for them. But specifically right now, we're talking about health systems, hospitals that are able to accommodate this population.
Thank you. And a lot of my seniors are 55 and over. They're able to get into the senior buildings. Now, will they be able to get it?
If I understood, they're 65 and older or 55?
No, some are 55 and over.
Unfortunately, the cutoff by the state is 65 and older. So it is those that are 65.
Even if they're in the senior buildings?
Even if they are, yes.
Okay. All right. Well, that's all I have at the moment, I think. Okay. Thank you, Dr. Hamami. And let me just say that the clinic did an excellent job. It was a long wait yesterday, but but they did a great job over at the clinic. So thank you,
Commissioner. I
You're
appreciate
welcome.
it.
And that's the Hamtramck Clinic, Commissioner Scott.
No, that was Wayne County's.
That was our drive-through.
Yeah, that was the
clinic.
drive-through yesterday.
Oh, okay.
Which
All
was
right,
like
but stay
2
there,
hours
Commissioner. I'll go around one more time if people have additional questions. Dr. Hamami, before I go around, I've got a couple of questions for you, or maybe even a couple of statements, but I'm going to repeat again. And I guess it's / waynecounty.com/COVID-19. That website will be updated every day with the hospital systems that we're talking about and where the availability is. Correct, Doctor?
Yes.
Yeah.
Yes.
So I think people bookmark waynecounty.com/COVID-19, both for the county and for the state information. The links to the state are embedded there, and you can do all your business there. And Doctor, just as I was listening to you with this phase 1A, we're probably somewhere around 40,000. You say maybe up to 50,000. And right now we're sitting on 2,000 doses, right? So I think, again, that goes to the patients that we need to show out there. Everybody wants to be first in line, and that's certainly understandable. But that's until the numbers start improving with the number of doses we get, it still is going to be this way. Is City of Detroit basically in the same situation we are with the number of doses that they're getting and how much is going out to the hospital systems there? I was going to ask you about the DMC, but you clarified that. Are they basically in the same situation over there with what they have available to them that we are in the county?
They do have slightly more, but I don't think that is the local health department proper. I think that includes the hospitals and health systems that are there. I know that their vaccination plan included a collaboration with Henry Ford and Wayne State University. My numbers say that the local health department got 2,000 doses of Moderna and 3,900 of Pfizer. And but the hospitals got almost 40,000 doses of the Pfizer vaccine. I think, again, these are like, we're talking about combined numbers between the health department and everybody else in the city of Detroit.
And that depends on the assessment of how many people in what phase.
Yes.
And so that will vary from jurisdiction to jurisdiction in terms of the total number you receive. Let's talk about side effects of this vaccine. Probably by the end of today, 10 million shots will go into American arms since we began vaccinating. I have no way of estimating, but I'd say worldwide, let's say there's another 50 million, so 60 million doses. There was great concern, that one doctor a week ago, I believe in California, that hit the media. What do we know about side effects of this, any of these vaccines now, and how they compare to, let's say, the MMR, how they compare to the annual flu vaccination? Are we seeing more or less side effects? Could you talk to us about that for a sec?
Absolutely. So, Mr. Chair, you mentioned these numbers that are very good and very promising. Let me take a step a little bit and talk about the side effects that they were seeing during the clinical trials. And now that we are almost 4 weeks into this, and in Europe, they started a little bit earlier than we are. And as you said, there is close now to, let's say, 30 million people that received the vaccines, and we know whether they had side effects or not. In the US, there is a very great and useful app that is called V-Safe, V as in Victor, Safe, that the minute you are vaccinated, you scan a barcode, and it asks you, when did you get the vaccine and what lot number, and whether it was Pfizer or Moderna. And then for the first 2 weeks on a daily basis, it asks you whether you experience fever, whether you experience chills and all that. And then it does that for your second dose as well. So this is, again, a great pool of data that is being captured as we are going into active vaccination. So far, the expected side effects are what we are seeing: sore muscles, soreness at the injection site, fatigue, mild fever, in some cases, high fever that can be up to 100 with some chills, but it shouldn't last more than 24 hours. All these are signs that the vaccine is working. Your body is reacting to it, and it's building immunity. Some are saying that the second dose is going to have more severe reactions than the first dose. As we are now getting into the second dose, we are, again, not seeing anything that is very highly concerning. As you mentioned about worldwide, I think there has been 4 cases of death that are being investigated as vaccine related. So 4 out of 50 million, that makes this vaccine safer than regular aspirin.
Okay.
So again, we're not seeing anything that would say the risks outweigh the benefits and let's stop.
Thank you. We've also talked about the age group. Well, we haven't talked to 0 to 16 not being vaccinated right now. Could you briefly describe why that is, and is that age group ever going to come into the vaccine protocol?
So this age group was not included in the clinical trials. So the clinical trials did not include pregnant women. So these are the 2 categories that currently it is not recommended they get vaccinated, just because we don't know what effect it might have on them. And this is simply why we're saying 16 and over. In the future, would clinical studies include that group and then it becomes similar to the flu vaccine? I suspect so. But again, right now, the priority is on the group where if you get the virus and the infection, then you will have a much more severe infection.
Are there current trials going on for those groups?
Not that I'm aware of.
Okay. All right. And I'm not going to ask you, I'm just going to make a comment on supply chain. As you and I have discussed, Dr. Hamami, and with other folks, this is probably the biggest, heaviest public health lift that this country has done, perhaps since the 1918 pandemic. And to think that we're going to go from zero, I know they've been working on supply chain stuff going back 8-9 months. People knew this was coming, but nonetheless, when the vaccine first, started being produced, to go from zero to get the total estimated maybe 400 million doses in people's arms, the first and the second, this was not going to happen overnight, and it wasn't going to happen. So my comment is, of course, there's going to be a lot of shakeout in the supply chain, and that's being worked on. I personally am not concerned that over the next month and a half, a lot of this is going to get ironed out. And I also want to comment, with a new administration coming in that might take a different approach, that will also cause waves through the supply chain as we get used to maybe a bit of a new way to supply all of this. So in the end, we're just at the beginning. Those are being worked out. But me personally, I don't have any real concern that a month from now, we're going to be looking at these same issues as we continue to learn as we go. Okay, I'm going to go one more time. Commissioner Marecki, do you have anything additional for the good doctor?
I don't. And again, I really appreciate the update. This is very
Yep.
timely for us right now. Thank you.
And we will be getting his PowerPoint with those numbers that we can share with our constituents. Commissioner Dobb, anything additional?
No further questions from me. Thank you.
Thank you. Commissioner Anderson, anything? Commissioner Anderson, do you have anything?
Nothing else right now.
Thank you. Commissioner Varga, anything occurred to you you'd like to ask about?
No, it's been a very, very good update. I look forward to the next one. Thank you.
Yeah, thank you very much. And Commissioner Scott, any further questions?
Sorry about that.
That's okay, Commissioner.
Okay. Not at this time. But again, thank you. And thank you, Dr. Hamami.
Thank you, Commissioner. Always a
Now,
pleasure.
Dr. Hamami, I kind of tease you a little bit about being our COVID czar. You are our chief health strategist, sir. I think I have that right now.
Yes, sir.
And very much appreciate, I know you've got busy day today, tomorrow, Saturday, Sunday. Now you got to go back and figure out what these millions of vaccines are that are being released from Washington and what the consequences of that is. I want to thank you very much for a straightforward presentation on really what's on the ground. I guess I'm echoing Senator Romney the other night in the United States Senate when they were talking about certifying the electoral votes, and he made the comment that the best thing we can do for voters is to tell them the truth. And I think the best thing we can do for the vaccines here is to tell people the truth. And people will deal with the realities of what we have before us, as long as they know the truth and they don't think, there's something nefarious going on here or anything like that. We're covering an entire nation, not to mention the entire world with this. So it's not always going to be smooth. We're learning as we go, and it's going to get better and better and better with each passing day. So again, thank you very much for your time, and I'm looking forward to getting my mitts on your PowerPoint, sir.
Will do. Thank you, sir. And I appreciate the opportunity. And again, anything that is needed from the commission and our public, we are more than happy to help with.
Thank you very much. And I'm sure another invite to Health and Human Services Committee is going to be coming your way. Thank you.
Sure.
Thank you very much.
Thank you.
Madam Clerk, Where are we at on the agenda, Madam Clerk?
Item D1, under new business, requesting commission approval of modification 1 to a sub-recipient agreement with National Faith Home Buyers.
Thank you very much, Madam Clerk. And please note on here that this contract was given exigent approval back on December 21st by the chair of the commission. That gives us 60 days as a commission to review this item and take it back to the full board for approval. Who do we have from administration that would like to introduce this item with National Home Faith Buyers?
Hey, good morning. This is Quasi Best Right Division Director for Veteran Services, and I'd like to go ahead and introduce this before the body for consideration. I have a lot of confidence in the organization to make sure that we go ahead and help as many veterans in Wayne County as possible with this initiative. So I do believe we have Dina Harris on the line as well, just to maybe speak to it if at all possible.
What will this do for veterans, sir?
Oh, wow. First, it gets them off the streets. So, you know, it's wicked cold outside. So it gets them off the streets for roughly 6 weeks of temporary housing. And then we focus on providing additional housing, long-term housing.
1 minute, please, Director Basari. Those of you on Facebook, please mute yourself because you're popping up in the middle of the meeting. Yes, ma'am. So if you can mute yourself so you don't pop into the middle of the meeting. Director, if you'd like to continue, please.
So what does this program does? It provides an opportunity for veterans living on the streets become be put into a temporary shelter, temporary housing solution, 6 weeks. Then within that 6 week period, we figure out how to get them some long-term housing solutions. If it's an apartment, or if we can help qualify them for some long-term housing to purchase a home. So it's a great opportunity. We're targeting at least 100 just to start off. And then we want to see how we can expand this program to address the needs of homeless veterans in Wayne County. And so what's great about this is for peacetime, wartime, honorably discharged, dishonorably discharged, any person that has served this country. This program will facilitate getting them into some housing immediately and getting them off those cold streets of Wayne County.
Thank you very much for that, sir. And I will comment that I've been on the commission about 14 years now. And as long as I've been on the commission, we've been doing business with National Faith Home Buyers.
Yes, sir.
In various aspects of housing. So it is a well-known contractor to do this work. We'll go around the horn. Commissioner Marecki, do you have any questions for the director?
I'm all set. Thank you.
Thank you. Commissioner Dobb, any questions? And tell me if I'm getting the last name. Betsarai?
Betsarai, that was perfect.
Thank you very much. I give it I give it. It's what being an old high school teacher will do for you.
Yes, sir.
Got to get those names of your students correct. Otherwise, they not showing up to class. Commissioner Dobb, do you have questions for the director?
No questions on this item. Thank you.
Thank you. Commissioner Anderson, any questions here, please?
Yes, and I mentioned this once before, and I know Mr. Betsarai, I was trying to work with our local folks, because out in this way there is some housing that could use some assistance for our veterans that were homeless. I will get back with you on that information. I know you indicated that you would like to help with that to see if we can get some assistance to them. And I'm trying to weed through the process and to determine what federal dollars are coming in currently, if there are any. But anyway, make a long story short, I'll get back with you soon. And has anything changed that they would not be able to get some assistance, or there is assistance you said in this fund? We're going to see if we can do more.
What we set aside some money for some veteran service organizations in Wayne County, and They're located in Livonia, Allen Park, and I think there's 3 of them in Detroit, in the Veteran Service Organization. So they can provide some immediate resources to veterans closer to their neighborhoods. And that would allow them to pay for some housing issues, some medical expenses, but there's a small amount of money that each veteran service organization gets from these CARES Act dollars. But primarily we are focused on the housing issue.
Right, but on the housing side, you're saying that you're open to trying to assist if there are other housing facilities that are helping homeless veterans right now.
I think we take a look at it and see if they can meet the criteria. We'd have to talk with National Faith Home Buyers and see how and if that organization could fit into our program. Because there's a contract they'd have to sign, and so we have to make sure everything is buttoned up.
Okay, all right, thank you.
Yes,
I
sir.
just to, if you don't mind, to add something, the funds are.
Please identify yourself, ma'am, name and title for the record.
Dina Harris, CEO, National Faith Home Buyers.
Yeah, well, welcome, ma'am. Haven't seen you in a while.
Yeah, The funds are for COVID relief and from the CARES Act. I just wanted to impress upon that. And I also wanted to acknowledge that there are 3 veteran posts, one in Southgate, one in Wyandotte, and one in Livonia that we're closing the contract up this week. And there's one in Detroit and a second in Detroit that we're still talking to.
Okay,
Thank you very much. Anything else, Commissioner Anderson?
that's all. Thank you.
Okay, I don't have any questions on this contract. So what's the pleasure of the committee?
Move approval.
Support, Marecki.
Anderson moves, Marecki supports. Quick pause here for any additional questions for committee members on this. Hearing no additional questions, we have a proper motion before us. All in
Commissioner
favor?
Scott.
Oh, Commissioner Scott, I'm sorry.
Yeah, I'm still here. Thank you. What do they have to go through one of the facilities in order to qualify for this? Or is there a press release that I could send out to some of my veterans?
Yeah, we're scattered everywhere. They can come to our office. They can go, there's 3 churches in Detroit. There are 3 organizations downriver. There are 2 VFWs in Detroit. So they've got lots of options, and there is a press release, Commissioner Scott, and I would be happy to send it to you. We did a sort of a press launch on last week, Quasi? Yep, and it was really wonderful. I sent over a thorough report on it. I think Channel 4 came for that event, and I believe 9 veterans showed up that day. So we're moving very quickly.
Okay, thank you, Ms. Harris. I'd appreciate it if you would send it to me. Thank you.
I'd be happy to.
Thanks.
Yeah, and I think
Thank you,
Director
Mr. Chair.
Thank you, Commissioner Scott. Director Besserai, I imagine you have that press release as well?
I do.
Could you send that to the, not necessarily to me. I want to make sure on these things that it just doesn't get to Commissioner Scott, that it gets to every commissioner. So if you could send it over, and then we can get it to all commission. And I don't know, do you have a regular place, sir, that you send it to the commission?
No, I'll take one right now. You give me an email right now.
Send it to me.
Yes, sir.
Send it to me and I'll get it around to all of my colleagues. Very important.
Very
Okay.
good. Thank you.
Yeah, thank you, Commissioner Scott. All right, so we have a proper motion before us. All in favor of that motion for approving this contract with National Home, please say aye.
Aye.
Aye. Opposition, please say nay. Any abstentions? Okay, thank you. What's next on the agenda, Madam Clerk?
Item 2, requesting commission approval of retroactive modification 5 to a 1-year comparable source contract with the 1-year option to renew with Detroit Area Agency on Aging.
And are we inviting Director Besserai back to introduce this that involves veterans, or who is introducing this, please, from the minister?
It's from myself, Lisa Whitmore Davis, Senior Services Director. Thank you so much.
Welcome, Director.
Thank you so much. This is a one-year contract that will provide home delivered meals to eligible veterans, and DAAA has been engaged in doing this for Wayne County. The prior contract expired in 2016 as they've been doing this for us. And so this is a one-year extension, I guess it's a retroactive modification of for $100,000 for the term being October 1, 2020 through September 30, 2021 with DAAA.
All righty, thank you. And I think we have been doing this for 3 or 4 years now with DAAA.
Yes, sir.
Yeah, to make sure that the county picks up the cost for meals for veterans in their Meals on Wheels program.
Correct.
Thank you. So we'll
You're
go
welcome.
to commissioners. Commissioner Marecki, any questions on this item?
Thank you, Mr. Chair. Lisa, how come this is retroactive?
It is retroactive, Commissioner Marecki, because it was finalized after we received the general fund allocation, which was approved on September 29th, and this was submitted on October 5th.
Okay. Because that will be a question. I'm sure you know.
Yes,
All right,
yes,
thank you.
yes, thank you. Thank you for the question.
Commissioner Marecki, you still have the floor?
No, I'm all set. Thank you.
All righty, thank you. Commissioner Dobb, we'll go to you for questions.
Thank you, Mr. Chair. With regard to the retroactivity, has any have any meals been delivered under this contract?
Yes,
Okay.
we did not want to have any discontinuation of service during this time period. So we have not stopped serving our home delivered meals to the veterans during this time period.
Okay, that's all I had. Thank you.
Thank you for your question.
Thank you, Commissioner. Commissioner Anderson?
No questions, Mr. Chair.
And I don't have any either. So what's the pleasure of the committee on this item?
I'll move approval. Anderson.
I'll support Dobb.
Thank you. We have a proper motion and second before us. All in favor of the motion, please say aye.
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 Opposed? Anybody in opposition? Anybody abstaining? Okay, so we have a unanimous. Madam Clerk, what's next on the agenda?
Thank you, commissioners.
Thank you. Thank you, Director Whitmore Davis. Good to have you come to committee. Madam Clerk?
E, such other matters as may be properly submitted before the committee.
I don't believe we have any. So we will move it to F for public comment. Now we have made available to people to have their public comment by email. And I'm going to check and see if there's any emails that have come in. And then we will open, I guess, open the unmute folks for people attending this meeting remotely to have their public comment. I don't have it in front of me. Does staff have the statement on public comment? That we can read to the public? You're going to have 2 minutes to address the commission for those with comments. And in public comment, as with every public body in the country, that this is not a time for discussion. We will take your comments and we will, if it does take a response, then that will happen after the meeting. During the meeting, we take public comment for 2 minutes and there's no discussion back and forth. So do we have any emailed questions, staff, that have come in for public comment?
No, we have not received any emails.
Thank you very much. And then I guess the process of somehow, how should the public notify us if they have comment for the now that are attending this meeting remotely?
It depends on however you want to do it. If you want them to raise their hand, I could tell you who's next, or if they want to put their names in the chat to go next, or if you want me to just open it to anybody and whoever speaks.
Well, everybody here can raise hands. Everybody
Everybody
that's
should have that feature to raise their hand if they want to speak.
okay. So let me do it that way. For those members of the public that are attending this meeting through Zoom, please use the raise the hand function in the upper right hand corner under more. Hit more, a menu will come down, and then we can call on you individually. So if a few people are doing that, do we have anybody yet that has raised their hand, Madam?
Yes, it says 1659 AFSCME.
165?
1659 AFSCME.
1659 AFSCME local 1659. If you'd like to unmute yourself and give public comment to the Health and Human Services Committee.
Yes, thank you for your time. This is President Buffington of AFSCME 1659. Are you able to hear me?
Yes, welcome, President Buffington.
Thank you so much. I just had a quick comment on questions from the commissioners for the doctor. We have a number of breakouts that have occurred through all the Wayne County offices, and you know of the loss of our public officials with this immunization. What wasn't asked is with the number that they have left out of the people that aren't being immunized, and they're doing the first responders, the first responders still go home to their family members. And we've had outbreak after outbreak after outbreak, and we've had exposure after exposure and the shutting down of offices. My question was to the health department, what initially have they heard from the government to figure out, even though you're receiving this immunization, and you're still a carrier, you're going to work, you're only immunizing a certain amount of individuals, this is still passing on. This is not fixing the problem. It's still a continued issue. I just thought I would bring that forward. Thank you for your time.
President Buffington, please put that in an email to me, and we will get that question answered over the next few days. If you would, please, President.
Yes, sir.
Thank you. Yeah, give me as much detail as you can.
Thank you.
Mr. Chair.
Thank you. Do we have any other hands that are raised, Madam Clerk?
No, I don't see any hands raised.
Mr. Chair.
Yeah, Commissioner Anderson.
Just wanted a point of information to pass along to everyone, including Mrs. Buffington, is that they're working on getting monitors at all the county facilities for the employees to be, their temperatures to be checked, and also a process where they can indicate whether or not they've been exposed, have a temperature, and things like that as precautions. So hopefully that'll help. It's not going to solve the problem, but completely. But that is supposed to be coming along. I spoke to someone yesterday, and I know they're working on that. Tim Johnson, that's on the committee that meets regularly, the executive committee, and also from Janelle Allen indicated they're in the process of getting those temperature stations in every county building. But anyway, that's all. Just want to make sure everyone knew.
Yeah, thank you for the information, Commissioner, and thank you for blowing the whole chair's gig about not having back and forth conversations. But yes, we will still get that, and I think we need to get that answer out to all commissioners too, so that they understand. Madam Clerk, this is my second call. I will say for public comment. Do we have any additional hands that have gone up?
No, I don't see any hands.
Okay, then I will make a third and last call for public comment. We want to make sure we give everybody the opportunity that would like to take it. So we're on the third and last call, and the clock is ticking. Okay, with no additional comment, we will move the agenda.
Mr. Chairman,
Yes.
and this is Felicia, and I apologize if I missed
Oh,
it, but
this is Commission Counsel Felicia Johnson. Welcome.
yes, with regards to public comment, did we unmute the phone line so that people could inquire if they were on the phone? And I don't know if you did that, Cheryl, and I missed it, but on my phone, everyone was still muted.
No, Commissioner Killeen, he said he wanted people to raise their hands, so I didn't know if he still wanted everyone to be unmuted with him going with that route.
Right, so the people who are on the phone don't have an option to raise their hands. So if we can
I'm
just make
sorry.
sure the
Yeah.
people on the phone lines are, if anyone was on the phone, if we can just double check by unmuting real quick.
Elected officials need all the help they can get. Thank you, Counselor. So let's give that a try. Clerk Lewis.
Everyone's unmuted.
Everyone is unmuted. Okay, and my apologies to people on the line. Now that everybody has been unmuted, is there any member of the public that would like to address on their phone, the Wayne County Commission under public comment? Anybody on the phones that would like to address the Wayne County Commission? One last call for anybody that is joining this meeting just by phone.
Yeah, we're gonna work on it.
Do you have any public comment? Okay, I'm going to say that's a no. So if we now can move the agenda, what is next, Madam Clerk?
Adjournment.
Pleasure of the committee.
So moved.
All right. Hearing no objections, we stand adjourned. Thank you, everyone, for a very informative meeting.